Hi, this is Kimika from Balanced Nurse Life, and today's topic is my experience as a COVID patient. Yes, so I will be taking you through what happened from my perspective, from my experience, and I'm just beseeching on everyone to be extra cautious because nobody is exempted from this COVID, and you could be as cautious as you want. Sometimes that 1% chance this virus gets, it just zoom in on you. You have ever seen like a mosquito coming to bite and it's coming at you and then it's zooming at land? Yeah, because there's a whole lot going on with this COVID. But before I get into that, let me just say to you all that Balanced Nurse Life is not about travel nursing only. We're a young channel, and I'll be looking at issues that affect nurses from nursing school, even it doesn't matter which level of nurse you are. And even if you're not a nurse, you can benefit from some of the information from this channel. In addition to all that, I'll be taking fun stuff because so I love fun. I love to do crazy stuff. So I'll be taking like mini clips on those and just to give you something to laugh about. So let us move to the video. Okay, so I am a crisis nurse and I work on the medical surgical tele floor for the most part, and we have been seeing some high numbers of COVID patients, and it is just like a well-oiled machine. Just as soon as you get someone well and the room is cleaned, we have a patient for admission. So it is just ongoing. It is just so crazy. And there's so much usage of PPEs going on. I mean, these hospitals, I can see where they might be really extending their budget to cover what is going on now, because this COVID pandemic, it is just crazy. So my experience was, it went like this. So let me start from the beginning. So I've been working medical surgical tele floors since, early in the summer, and I have seen like spatterings of COVID patients. And then when it comes to about the ending of October to November, then we see the second cycle of COVID flare-ups. So as usual, pardon the car, I'm videoing outside on a patio. So as usual, we get our PPEs out. We have our headgears, we have our footwears, we have our N95 mask, we have our normal mask, we have shields, we have disposable gowns that we wear, and whenever we get into the patient's room, we put a plastic gown over that. So you have like the disposable scrubs, pants and a top that you put over your uniform, and then when you're going in your patient's room, that is for my hospital that I am. When you're going in the patient's room, then you put on one of that blue disposable gown, your gloves, and you go in, deal with the patient, and you dispose of that glove and the disposable gown, and you exit the room in your scrubs that is provided by the hospital. And I mean, we were swamped. We were run off our feet. It was crazy. I mean, I was just, sometimes you know, because I work in night duty, and sometimes you're there and sometimes you really feel overwhelmed, and you have to just you just have to take a deep sigh, stop, take a deep breath, and move on again. That is how bad it became. So, and on the floor, doing what we do best as frontline workers, and sometimes we have the 1 and 2 emergencies that crop up when we have code blue, and you know what code blue is all about, and everybody get busy. Now, I am not saying that I caught my COVID in a situation like that. You know, I keep on still pondering and wondering, how did I get it? Because I try to do everything I could possibly think of people to make sure that I am safe. And it ended up that I did caught COVID-19. So it all began like December 8th. I was feeling a little exhausted, a little winded, you know, get some shortness of breath whenever I really exert, because sometimes I'll be kidding with my patient and said, oh my God, I should have worn my skates tonight. I would have lost some serious pounds. And, you know, we'll make fun of what is going on, you know, to just make sure that the shift proceeds smoothly and you enjoy it as much as you possibly can, you know, especially with the situation that we have at hand. And it was just like that. So December 8th, I remember feeling like that. I feel a little sniffling, and I said, okay, wow, my allergies, my eyes were red, and all the signs that indicated that my allergy was acting up, I was seeing all those. So as expected, I treated myself for my allergy. Yeah, it go away, it come back, or maybe the medication suppressed it, and then, you know, I am back at square one. And then I was off for about 5 days from work, and this Monday now, which is December 14, if I remember correctly, I was to work and report to duty, started working, started feeling some aches and pain, but I didn't entertain COVID, because I have other issue where I will feel aches and pain, especially in my joints. So I didn't entertain COVID one bit. It was the farthest thing from my mind. So when I was feeling my aches and pain, all right, let us let the Amazon van go by so we can continue. So when I was feeling my aches and pain, as usual, I take my NSAID. Guys, it just get, as in my language, it just get wicked in our Jamaican term, meaning all my symptoms was just crazy. It just exacerbated my symptom taking that NSAIDs. Because remember, I wasn't thinking COVID. I was just saying, okay, I was having my aches and pain because of my medical illness, you know, my medical condition. So I take my NSAID as prescribed by my doctor, and it just worsened my symptoms so rapidly. It was, if I didn't know my body, I would be thinking crazy stuff. And then the pain was so bad. I could feel fire coming through my eyes. That's how it is burning. My eyes are aching. I was stuffing, my ears aching. The breeze, when it blew on my skin was aching. Even my toenails feel as if they were aching. I'm not exaggerating, guys. And at that point I said, oh no, this is something else. This can't be simple allergy. Hell no, I'm going to get some assessment. So I said to one of my patient care tech, can you do my vitals for me? And she said, sure. What is it? Please don't bother me sick. And I said, you know, I'm not feeling so hot tonight. I'm not feeling so well. I think something is going on. And she said, okay, have a seat. And when she took my temp, it was 102.2. My heart rate was 162. My blood pressures were low 90s, 50s. And it was just crazy. So I said, you know, let me tough it out. You know, we nurses, even when we're dying, we put our patients ahead sometime. And I say, you know what? The floor is short. Let me finish medicating my patient, get them settled in bed, at least do their assessment. So when I hand over to my charge nurse, because she's the one who would have to take my patients, and I mean, I have 6 patients, 2 of whom were new admissions that I did that night. And when I handed over to my charge nurse, she was like, oh my God, Kim, oh my God, I can't believe you're sick. I said, yes, I'm going by the ED. Guys, I'm telling you, by the time I went in the elevator and went downstairs, at one point, I was in the tripod position to breathe. I was like anchoring over. You know how our asthmatic patient, when they're having their status asthmaticus, how they, hunch over in a tripod. And I couldn't catch my breath. I felt like my breath was stuck between, it was mid passageway. I couldn't exhale. I couldn't finish my breath. It was the most frightening experience. And this experience put things in perspective for me, because it gave me a deeper understanding and compassion for my patients who have difficulty breathing. You know, not saying that I wasn't empathetic or compassionate before, but this just gave me an inside look, because I have felt it. It gave me an inside look as to what these patients are experiencing. Now, I went to the ED, and I must say, big shout out to my Piedmont Rockdale ED staff. That night of the 14th to the 15th of December, the morning, excellent. I'm not saying that because I worked there and, they treated you, regardless if you're a traveler, as one of them. But I was on the floor basically because I couldn't breathe. And I don't know, but God sent this nurse. Maybe as a matter of fact, let me tell you what sent that nurse. The urge for Pepsi. You know that urge, guys. Yes. So God sent her to the soda machine for Pepsi. And she saw my head and she came up and said, can I help you? And I was having one word. Yeah, just like that, just like our status asthmaticus patient. And she said to me, don't move. And she ran and get a wheelchair, and she helped me in that wheelchair and took me straight to the registration, handed my documents to them, and she didn't leave my side one bit. She then wheeled me into the triage area. She got it. The doctor was there. She was there. Because my saturation wasn't so as they wanted. Initially, the intensivist came down to see me, and the respiratory therapist on duty, she took an ABG sample, and I did a chest x-ray, I did CT scan of the chest, because, there are other things that can happen. And a battery of blood test was done. Also, that dreaded COVID test. Guys, my previous test, I felt as if the nurse went in the back of my brain. So, who started to be like a wimp? Oh, yes! I started being like a wimp, and I was like, oh my God, do I have to take it? Can you swab the back of my throat? And I must say, my handsome nurse, he said to me, oh no, you know that, Kimika. We don't swab the back of the throat here at Piedmont, Rockdale. I'll be gentle. And I was like, gentle? In my head, I was like, really now? Gentle? Because I was remembering my 2 previous COVID tests that I did. They weren't gentle? No, they weren't. So I started imagining the worst. We medical people. Yeah. So he said, okay, you're ready? And I said, oh my God, I can't take this. But guess what? I was so distressed. He could have taken out my arteries and my vein and stitched them while I'm awake without giving me something to deaden the area. I would have welcomed anything. So he put it down and he was like, see, my hands are free. I'm not going to spin it or anything. I said, but it's there. He said, yes. How are you feeling? I said, oh, it's not so bad. And then he took it out, and without a doubt, it was COVID positive. So I spent the day in the ED because, they were trying to get me up and about without admitting me to the ICU. A bit of ambulation, and while ambulating, on room air, my saturation was acceptable enough, and I was discharged in the early morning. Now, you know, at Balanced Nurse Life, family is everything. And in my life, family is everything. So, you know, I have to give updates to my children. And my eldest, Sayine, I love you, sweetheart. She booked a flight to where I am. She booked a flight to Georgia. And she was there by, I think, 10 o'clock, 10:30. She was there. And I must tell you that I'm very proud of her, because she has a phobia of driving on highways, you know, major highways. She normally don't do long distance driving. We're the ones who will do it. And she took the wheel and she drove. Her house is actually 9 hours away from where I am working presently. And she drove in this family support was awesome. Our family friend, he gave up his apartment so I could quarantine, because he's a single dude, and he gave up his apartment so I could quarantine. And my children take turns calling me, nagging me. Yeah, after a while it seems like nagging, but guess what? I was most appreciative of everything that they did. I was really appreciative. So it took me about 3 weeks, and during the onslaught of COVID, when it was in full swing, I could not eat, I could not sleep. I was aching in every joint possible. I was aching in my muscles. I was nauseated. Luckily, I wasn't vomiting. I was so weak. At day 10, my legs weren't holding me. I was like, I had to hang on to the walls to guide me to the restroom. One night I was there alone, wanted to go to the restroom, and I felt my legs gave way. And when I realized what was happening, I turned myself to the wall and slid down the wall. I crawled to the bathroom that night, and I crawled back to bed. I didn't even remember about germs on the floor or whatever. It was that bad. I was so sick. And what was ironic, one of my medications that I take is hydroxychloroquine, or Plaquenil as we know it. And my doctor said to me, but they were thinking of that drug as one of the treatment of choice. And you take this every day and you still get COVID. And I tell her, yep. So it was never a very good treatment of choice. But I forced myself to drink, because dehydration was a big thing. Within 3 days, my mouth was so dry. My tongue was so dry. I could see the change, and I was drinking, I was pushing myself, and in my head I was saying, oh my God, this is what our patients go through. This is so horrible. And it was just a lot for me. Well, I survived, thank God, because not many people live to say that are they recovered from COVID. We have quite a few deaths from COVID, and a lot of us, whether we're affected by it physically or we are affected in some way or form, it's either financially, emotionally, physically, because financially you have your jobs with hours cut, or where you're working might be an industry that need people to be physically there, and that place closed down and you're sent home. Other persons are affected by it emotionally because they have lost someone. And if you have been diagnosed with COVID, you're not only suffering from it physically, as in physiologically, as in the illness, the toll that it takes on your body, you're also suffering from it emotionally, because you're thinking, am I going to make it? What is going to happen to me? And even though I know all these answers as much as we can know from what is there from the research for COVID, I did have those, I did have those thoughts. And it was not fun. Now, finally recover from COVID, about 3 weeks. Christmas celebration got interrupted because Christmas Eve I was on a televisit with the doctor because I was in distress, respiratory distress. I was in painful distress. Nothing was working, and the family pulled together and we did have Christmas. I returned to work January 11th, started the 10th because, and yeah, guys, my friend said to me, Kimika, you're crazy. You're just recovering from COVID and you're going back to work on the COVID floor. And I said to her, somebody have to do it. I'm not the only frontline worker who was diagnosed with COVID and recovered and returned to work and care for COVID patients. We just have to do what we have to do. So I returned to work and work the 10th was okay, more winded than normal, having a little bit more shortness of breath than normal. My PCP had said to me that that will happen, but from my experience caring for patients post-COVID, because I've had patients returning with a second diagnosis of COVID, and I've had patients returning with pneumonia secondary to COVID, and I've had patients returned with PE, DVT secondary to COVID, because those two conditions seem to walk hand in hand with this COVID. Is either it happened concurrently when you're diagnosed with COVID-19, or it's one of the complications after recovery. Also, we have had patients who post-COVID, maybe they had, a cardiac problem that they weren't aware of, and this experience with COVID exacerbated. So we have had patients returning with congestive heart failure, So it is no joke thing. So I had a cold, and after my chest compressions and exertions, I started having chest pain and really labored breathing. But I said, okay, maybe because I really exert, because we really worked on her, but unfortunately my patient died. And after I badge out, I went to the supermarket to pick up some smoothie and fruits and yogurt, and just to leave the entrance of Publix and get to the fridge to get my orange juice, I was breathing so hard. I was using accessory muscles. My chest was just aching. I felt like someone is just squeezing my lungs with a wrench. That's how I felt. I said to them, this is not cardiac, because when I went to the ED, I said, it is not cardiac. I'm feeling as if my lungs is squeezing. That's how I felt. And they quickly get me in, gave me aspirin 81 to, in the event that it might be a cardiac thing. I got my aspirin 81 milligram to chewable, which relieved the chest pain, thank God, because I was breathing so shallow. I was scared to breathe, because with every breath that I take, it felt as if my chest is somebody just had their fist inside my chest and squeezing my lungs. That's how I felt. And we did some blood tests. We did the array of blood labs. Chest x-ray was done, and my chest x-ray showed some infiltrates, some scattered spots in it, some infiltrates, and some areas that look a little dense. Also, my D-dimers were high. And in light of that, because our D-dimers is one of our tests that check our clotting indices. And whenever our D-dimers are high, we have patients more than likely, especially if they have previous history of a DVT or a PE, we need to entertain that. So the doctor said to me, okay, we're going to do a CT chest because we need to really eliminate what is going on with you, seeing how you describe your pain and seeing that the aspirin aids with your, and the oxygen aids with your chest pain. Let us see what was going on. Thank God, people. Thank God my CT scan cleared me from a PE. I was like, whew, I'll take pneumonia over PE anytime at this time. So the nurse heard me and she started to laugh. I said, yeah, pneumonia is less of the evil. I'll take that over PE right now. I can't deal. And I said, oh my God, after COVID, I am feeling all this post-COVID saga. This just needs to end. So I got my albuterol pump to help me. And the doctor said to me, okay, Kimiko, I'm giving you 7 more days to go home. You need to go home and care for yourself. Thank God my 7 days are done. Today is day 9. So today is 2 days post my sick leave. And I must tell you that I'm feeling awesome. I am just so relieved that I am feeling a little bit like myself. I am really relieved. Still feeling tired easily than normal, but I'm just so happy. I know this is a long video, guys, but I just want to beseech to everyone out there, just be careful. You can never be too careful. I still try to analyze the situation to see where or what went wrong, why I was diagnosed with COVID. But as nurses, you know, we are in constant interactions with our COVID patients. And I think that is one of the determining factor that really is going to work against us. From the minute you get to work, you're on your feet straight. I've lost a few pounds. I'm glad, but you just have to be super vigilant at the front line to make sure that you hydrate, to make sure that you keep your kidneys happy, to make sure that you get something inside of you, because exhaustion, poor nutrition, constant contact with COVID patients, if you have other medical conditions, these are predisposing factors for healthcare workers to become sick. And we have lost healthcare workers from the front line. We have numerous healthcare workers getting sick, recovering, and getting back to work. And it's just a cycle. So I felt like I've been preaching, but I really need to talk about it. This is just a honest truth. This is just my experience and my introspection and everything that's been happening where COVID is concerned. So this is all. If you enjoyed this video, please subscribe, share with a friend, comment below. Just be awesome. Have a good day. Bye.